evening to you. Welcome to this Tuesday's edition of the Watchdog. My name is Vuyo Mvogo. On the show tonight, a good story to tell. How a group of South Africans entrusted with billions of rands to help the country respond to the coronavirus epidemic have done us all proud. How did they do it? We speak to the Solidarity Fund's deputy chairperson about doing well in a space where allegations of fraud and corruption often hog headlines. We also speak to some of the beneficiaries. And as one of your leading shows when it comes to election coverage, we bring you an update on the day's election news. That and more coming up in today's episode of The Watchdog, which starts right now. Established early last year to raise money from the public and other donors to help the country respond to the coronavirus pandemic, the Solidarity Fund today presented its integrated annual report, audited financial statements, as well as a projects update. Our reporter Notando Magudulela takes us through some of the salient points of their presentation.
The Solidarity Fund is a public benefit organization established to confront the COVID-19 national crisis in South Africa. It is now 18 months into the national lockdown since the establishment of the fund. Today, the fund presented its first integrated annual report since its inception. It says that it has raised over 3.4 billion rand in the period between March last year and September this year. Of that, over 2.6 billion rand has been dispersed in its three response pillars. In addition, the fund raised over 800 million rand to support those who were impacted by the violence and the looting in July.
A third phase of fundraising was undertaken after the Solidarity Fund established the Humanitarian Crisis Relief Fund, which was a direct response to the challenges resulting from the unrest in July. This fundraising drive raised 489 million, including 400 million that was donated by the National Treasury from the RDP Fund.
The fund says under its health response pillar, the focus has been its vaccination drive. It says 80% of its expenditure is on health responses and 20% of it goes to vaccines.
More recently, we have also funded temporary vaccination outreach sites across the country that will add to increasing the overall national number of jabs per day to achieve the 250 to 300,000 jabs daily. These additional sites will contribute to improving geographical coverage, population reach, and especially access to vaccinations.
The fund has its annual report audited by PwC on a pro bono basis. PwC found that the materiality in the report was an ongoing concern because, like any other non-profitable organization, it has no end date of existence.
We draw attention to the material uncertainty that management have identified, and the material uncertainty in particular relating to going concern, where purely because of the nature of the entity, as Zanele alluded to, the company does not have a specific period of existence, and its termination will be determined by the directors, taking into account the considering the necessity to maintain its operations.
The fund says it remains transparent as most of its projects are coming to an end. This is because the country's focus has now moved on to vaccinating citizens. According to the fund, although most of its projects have come full circle, its existence could continue until the end of September next year. Notando Magudulela, SABC News, Johannesburg.
For some insights into how this fund has been managed and the work they have done, I'm now joined by Deputy Chairperson Adrian Enthoven. Adrian, good evening. Thanks very much for your time. Congratulations are in order, I suppose. Well done.
Thank you very much, Vuyo. I mean, we're extremely pleased with the outcome, obviously, of the audit and the results of the audit process. I think it's worth mentioning that, we chose, very unusual for an NGO, an independent organization like ourselves, we chose to have our financial statements prepared in accordance with International Financial Reporting Standards, IFRS, which is the highest reporting standards. It's the same as global, multinational companies are audited on that basis. And I suppose that's kind of part of our commitment. We're a fund for all of South Africa and accountable to all of South Africa, and we wanted to make sure that there was full accountability and transparency in everything that we've been involved in. But I think that, the key story is not just the results of our audit process, but I think just the impact that we've been able to have over the last 18 months.
Mm-hmm. Well, before we get to the impact, I just want to stay with the audit a bit. Was it just, making sure that, you are audited in line with international standards, but were there other processes or other things that you put into your machinery to make sure that, there's, books are done properly, money is managed well, it goes where it is supposed to go? And I'm asking this because a lot of state entities, battle with, especially in crises, during crises, they battle to, on the one hand, deliver, in line with their mandate, but at the same time, especially during a crisis, being agile, that's on the one hand. And then on the other, ensuring that, books are done properly, there's transparency and so on.
So I think that we benefited from having, an enormously experienced board, independent board of directors that drew from people from the private sector, civil society and government. Very experienced board. Subcommittees of the board were run by independent directors. We had a very strong executive team. We recruited the best people that we could find, and I think that made a huge difference. It meant that our governance and processes were not only of the highest order in relation to how a fund like this gets managed, but that we were also able to work in a very agile and rapid way. That was really the role for us to play. Our resources were much smaller than the total resources that were being mobilized to address the crisis. But we were able to focus on, the really high impact interventions where we would get the best bang for our buck.
Mm-hmm. Okay, that speaks to governance, accountability and so on. But let's talk a bit about operations. Operationally, what did you put, into your system to actually give you the kind of outcome we are talking about today? I'm talking about from how you managed the fund on a day-to-day basis.
So we had a core executive team of, I would say 15 to 20 people. In the early stages, I think just one very important point is that every staff member at the Solidarity Fund and every company that was supporting the fund was pro bono. So every staff member was either seconded from a company or an NGO or was working on a volunteer basis. So we spent no money on expenses or overheads at the fund. We had a core team that a number of the members rotated over time. But in the broader team, what we were able to do is bring in these volunteers and seconded individuals that brought very deep capability and expertise in these areas. And I think what was very powerful about the fund was that we could draw in expertise from the places where it existed in society. So in relation to our humanitarian efforts, we brought in the best advice that we could from civil society organizations, from the likes of the United Nations and others. So in our three core pillars of the health response, the humanitarian response, and the solidarity campaign, our communication and behavioral change campaign, we were able to bring in the best brains to both think through what needed to be done and then to also execute on those programs.
But did you bring on whoever raised their hand, or were you selective? In other words, was there a deliberateness about who you decide to bring on board from the pool of people who raised their hands?
No, it was very deliberate. We knew what needed to be done in the different areas, and we knew we needed the best people to do those and to assemble teams of people with the kind of mix of skills and experience that would be required. And I can't tell you how many companies and individuals were putting up their hands and offering to come and join us on a volunteer or voluntary basis. And we had to be very selective. I mean, ultimately, we only had one critical kind of lens that we looked at these issues at, and that was, what do we need to have the biggest impact that we can have in this crisis, and who do we need, what are the teams that we need to build to be able to execute on that?
And how do you decide, what to allocate money to or who to give money to? The selection process.
So I think it's important to note that, I mean, it's different for the different areas that we worked in. So let's talk about the health pillar, because that was the largest part of the fund. I mean, the bulk of 1.97 billion rand of the 2.6 billion rand that we've spent to date has been spent on the health pillar. Mm-hmm. And in that, what's important to say is that the intention was never that the fund would create our own health response to the crisis. It was like there is one health response, there's one health strategy that's been led by the National Department of Health and by government. And the question for the fund is, how can we best complement and support that, ready the health system for the crisis, the health crisis that awaits us, and what are the interventions that we can implement that can have the greatest impact. And just to give you an idea, in the early stages of the crisis, we were one of the first and largest kind of procurers of PPE, of essential medical equipment, we launched the procurement of locally manufactured CPAP machines, ventilators, and it was really understanding what are the things that are going to make the biggest difference. And each of these projects are projects that we conceptualized with the National Department of Health. I mean, very important to understand that we operate as a completely independent organization, so we understood what the needs were, and we went through a process then of understanding for us, what are the projects that we think best suit the fund and where we think that we should intervene.
And how did you do it? Did you give people money, or did you purchase or buy goods or services on behalf of people of other people? So
let's just take some practical examples. I mean, if we look at things like PPE and essential medical equipment, we would understand where the greatest, what were the items of PPE that were most in demand, most in need, or the medical equipment that was needed in the different provinces. Where was the greatest need? What were the highest priorities? We would then, we don't have the infrastructure to do procurement directly ourselves. So we would then partner with an organization that would help us do that. So if we look at PPE and essential medical equipment, we partnered with Business for South Africa. Business for South Africa assembled a team, a highly experienced team of medical health practitioners, of health procurement specialists from the private sector, a really strong team that was able to procure at the best prices the goods that were available and that were needed, and we would then deliver those goods to where they were most needed.
So I suppose in that way you were then able to avoid a situation where a mask that costs $20 gets bought for 320 rands instead.
Yes, and I think this is very important, Vuyo. I mean, in the early stages of the crisis, when we were doing a lot of the big PPE orders, we had a daily monitoring of prices to make sure that, because prices were moving, I mean, on certain items like masks, prices were moving on a daily basis. And we wanted to make sure that we were always paying what the kind of market price looked like at that time. I mean, the other thing to say just on all of this detail is we have over 450 pages of reports on our website where we talk about every single piece of PPE we acquired, every medical equipment, the ventilators and so on, the testing programs, and where the money was spent, how much money was paid for each PPE item and so on. So there's complete and full transparency on our side about all of that, but absolutely critically important that we don't overpay. And as important that we get quality equipment, essential medical equipment. I mean, this is the equipment, the PPE that was going to protect frontline healthcare workers and also community healthcare workers in the not-for-profit sector. And it was very important to us that the quality was right. And so we had very strict quality controls with the SABC to make sure that every single shipment was properly checked before it went into the field.
Were you ever in situations of, do you ever find yourself in situations where you battle to say, decide whether to give, to organization A and, not B, and were there instances where you had to say, sorry, we can't help?
So again, I think it's important to look at across the different pillars. So if you look at in the health space, I think we had a pretty good system for understanding what the needs were in the different provinces, where the big priorities were, and how best to allocate that. So we didn't have like organizations approaching us and asking for our support. And I think that's also an important thing to say, is that we weren't like a traditional kind of grant maker where you could just submit your applications and then we would process it and give you a grant. Each of the projects was very strategic. It was very focused. It was designed to have impact at scale, because obviously there's a limit to how many of these initiatives we were able to manage. I mean, there are some areas. So, I mean, if we look at in the space of, and I believe, later on in your show, you'll be speaking to one of the organizations that benefited from a grant. But one of the areas where there were some areas where we put out call for proposals, and one was the two humanitarian areas that we focused on were food security and gender-based violence. And in the area of gender-based violence, we recognized that there were many community-based organizations and NGOs across the country in communities who were playing a critical role in addressing the gender-based violence crisis that was exacerbated by COVID-19. And we put out a call for proposals and ended up providing grants to over 300 community-based organizations across the country that have addressed the needs of over 400,000 victims of gender-based violence.
Were there some you couldn't give to, where you had to say, sorry, we can only afford to give to so many?
I mean, it's yes. I mean, that is the case. We only have obviously a limited number of limited resources, and we want those resources to go as far as possible. And obviously, we had checks on the organizations that applied to make sure that, obviously, what was really important for us is that, we were the custodians of money of South Africans. We had over 300,000 South Africans that donated money to us, over 3,000, almost 3,000 companies and foundations. That's a huge responsibility for us. So we needed to make sure that every organization that we gave money to, that there were the proper checks and due diligence done on those organizations, that we were comfortable to donate that money. In some cases, organizations didn't make the cut. In some cases, we had to just focus on a limited number of organizations because of the funds that we had available.
You also got yourselves involved in the violence and looting, at least the aftermath of the violence and looting we saw in parts of Gauteng and KwaZulu-Natal. Anything that stands out from that experience?
I mean, I think the thing that we recognized at that time, I mean, firstly, this was, I think, an unprecedented crisis for the country since 1994. It needed urgent and immediate attention. It created very significant challenges in terms of the response to the third wave in KZN in particular, but also in Gauteng. And we felt that we were the organization that was trusted and that was best placed to respond to the crisis and to receive donations. As Thandi said earlier on your show, we've received 489 million rand of donations. 400 million of that came from government. We allocated 100 million of the Solidarity Fund's money after consultation with donors. So we have a total pool of 589 million, and really we focused on three main areas. The one is food security. The second is access to medical supplies. I mean, in particular, there's been a real crisis of the access to chronic medication because of the looting of facilities that provided chronic medication to patients. And finally, to support, in particular, small businesses to get back on their feet again.
And we've also recently, according to the CEO, gotten involved in the vaccination drive. How is that going?
Yes, no, so I mean, that is a very, very significant focus for the fund. I mean, I think, we are very clear that the whole country needs to get behind this vaccination effort. It's the only way that we're going to return the country to and get the economy back on its feet again, country to some kind of normality. So this is of essential importance for all of us, I think, to kind of focus on. We began supporting the national vaccine rollout program with the 283 million rand deposit we paid for COVAX, and we're really pleased that with what we were able to help support catalyze there, because we've received over 10 million vaccines from COVAX to date. We also supported the Sisonke study right in the beginning to vaccinate frontline healthcare workers. We provided support to the National Department of Health capacity to help build capacity there to implement the program. We provided funding for a call center for some of the social partners who involved to help drive vaccine demand. And then I think one of the really big programs that we've got, I mean, two really, really big. One is the national Roll Up Your Sleeves campaign that we've launched now, to really get South Africans not only to vaccinate themselves, but to help join the campaign to get the country vaccinated. And secondly, to provide surge capacity vaccination sites in areas where vaccination rates have been low and access is low. So this is part of kind of vaccine equity, but also really trying to kind of penetrate the areas where it's been more difficult to get the vaccination rates at the level that we need them to be. And then finally, we've also commissioned kind of research with the GCIS to understand more about the dynamics around vaccinations and where we should be focusing our effort and attention.
With everything you've learned, everything the fund has been able to do, how you manage things, have you among yourselves, with that background in mind, formally or informally, have had any conversations about the possibility of perhaps sustaining this effort beyond COVID?
So I think the purpose of the fund is very much front and center for the board and the management team, and that is to really play our role in kind of uniting the country in the fight against COVID-19, and to utilize the funds that we've raised through these donations to have the biggest impact that we can have. I mean, that really is our focus, and that's what we're geared to do. I think we are facing a situation where we have allocated almost all of the funds that we've received. And I think that at the time when our funds are fully dispersed and we feel that we've met the mandate of the fund, we will then consider what the future of the fund will be. But it'll not be what it is now. I mean, the fund was set up to respond to the COVID crisis. The intention is to close the fund probably in the latter half of 2022 of next year, because we need to close out our financial accounts at the end of February, and there's the process of the audit and so on. So there's no intention at this stage for the fund to become some kind of permanent institution. We're still run largely in fact entirely by volunteers and seconded staff, and so that's not something that can happen indefinitely. So if the fund was to become something different, one would have to look at that very carefully.
And that's where we're going to leave it, Adrian. Thank you very much for your time this evening.
Thank you, William. Thanks for having me on your show.
Thank you. He's the Deputy Chairperson of the Solidarity Fund, which today gave journalists an update on how they have run this fund over the past 18 months, the things that they have done and the things that they are still to do. And from conversations one has been hearing throughout the day, there's a case to be made for the kind of model that they have followed. It could just help unblock a lot of the problems we've seen from state entities, how they found it difficult to perform, how monies disappear, and how lethargic they can sometimes be. Our controls and accountability are sometimes thrown out of the window. Something really, this is probably really a good case to follow and see if it can't help us going forward. After the break, we'll speak to some of the beneficiaries of the Solidarity Fund. Don't go away. Welcome back, and if you missed it, we just had a conversation with the Deputy Chairperson of the Solidarity Fund. Today, they took us through their annual report, their audited financial statements, as well as the projects that they have undertaken since their establishment over 18 months ago. And joining us now are two organizations that have actually benefited from the work of the Solidarity Fund. Please welcome Mariam Mangera, who is the project coordinator at the National Shelter Movement South Africa. Sihlendima is a director at Pepelo Girls and NPO. Good evening to both of you, and thank you so much for your time. We're going to start with you, Mariam. Just take us very briefly through what your organization does.
Good evening, Vuyo, and thank you for having me. Yeah. The National Shelter Movement is an umbrella organization that looks at advocating and lobbying for shelters for abused women and their children in South Africa. At present, we have 95 member shelters under our umbrella.
Sihlendima, what does your organization do?
Basically, we're based at the Durban CPD as Pepelo organization. We're helping girls that are living on the streets of Durban.
Okay, how do you assist them?
Okay, we're renting a space at Daneseli Center. So in the morning, they have shower, and then we have a lady that is cooking for them. We run more therapeutic session. And there is a clinic in the center, so there is a linkage to care as well. So the model is big on reintegration, as well as yes, motivating them with arts program.
Okay, Mariam. So how did your relationship with the Solidarity Fund start?
The Solidarity Fund reached out to the NSM, wanting to assist us with PPE. Towards the end of April last year. We then had numerous consultations because we understood that PPE wasn't the only thing that our shelters required. We then set up to put together guidelines on what could be purchased, and there were four main criteria that our spending had to fall under. For that, they then selected 78 shelters that fall under NSM that would be recipients to this funding. And we then had to ensure that the funding was dispersed directly to suppliers, and then suppliers had to provide the PPE to the shelters. We then had to ensure that the suppliers were paid once confirmation was received, and we have to bi-weekly report to the Solidarity Fund.
And how did you find that experience? I mean, how quick was the system? How effective was the whole process you had to go through to do everything you've just described?
So it had to be very, very efficient. We did have a few hiccups in the beginning, but once we were up and running and we set up internal controls and we made sure that we had centralized suppliers for PPE, and we were the ones that actually determined what would be on the supply list. We could then control how PPE was being dispersed and what was being dispersed, and also ensure that the amounts were correlating between shelter spending.
Sisha, what was your organization's experience?
Yeah, the experience started last year when we were applying based on the GPV program, because as we're dealing with kids and women that are living on the streets of Durban, they are mostly highly affected on this program of gender-based violence. So the cry was like, okay, we're dealing with kids on the street now. We want to go to radio station, to go to different high schools and raise awareness and talk about this issue that's it's been a problem in our country. So we have applied for a fund, And then this year, we were so lucky to be one of the organizations that were selected to have the funds. So we're running our programs strong at Danes Health Center. There is days where we do outreach just to see who is in the streets. There's days where we get up and in the Southwest, go out in the communities with community dialogues, as well as going to radio stations and different high schools to talk about this issue, which is very big now, especially youth.
But Mariam, I mean, I'm sure in the life of your organization you've had to deal with a lot of entities, you know, that are supposed to or can or should help you. How would you compare how the Solidarity Fund dealt with you, you know, in the year or so that you had to deal with them, with, you know, your encounters before then with other entities, including state entities that you had to deal with?
It was actually very efficient. Every time we had a query, they were always available to assist. We had a specific liaison that we dealt with, and she was always available. If there was more in-depth information that we needed assistance on, they would set up virtual meetings where we would discuss. Like initially, we were only given funding for PPE, and we realized very soon that we would have a problem if clients went to clinics and hospitals to get monthly medication. So Solidarity opened up for us to allow our clients to get medication from pharmacies and private healthcare facilities. They also allowed that we could do COVID testing through Lancet. So we then managed to have an arrangement with Lancet so that we would directly be billed on a monthly basis, and the shelters had a specific form that they could use. And because of the efficiency and the openness to understand what our issues were between ourselves and the Solidarity Fund, we were able to make those changes, and then new contracts were drawn up to actually accommodate these.
Was the experience similar for you, Sihle?
With gender-based violence. So the experience with us of reporting was always on point when we just explain exactly what we're hoping to achieve with the funds, and then with the reporting back, and then looking at having meetings on Zooms with other organizations to see how can we link and work and assist one another. So it's been an eye-opener and a great opportunity that's to work with Solidarity Fund so we can even see what other organizations are doing.
Mariam, I'm keen to know, like, sort of what, and we don't have to, you know, shame people here or anything, because just from hearing what people have been saying, you know, throughout the day, and of course what the fund itself reported today, what do you think are the sort of other lessons that other entities can actually learn, you know, just from the experience, or what the Solidarity Fund managed to do right? In other words, what would be takeaways from you that if in future, you know, when you have to now, when things go back to normal, you know, what would you like to see from the organizations, especially those that are, you know, state-funded or state entities themselves, you know, that need to help you in your space? What can they take away from what the Solidarity Fund has been able to do?
I think the most important thing was they listened. They had an idea on how they wanted to work, but they listened to what it is we did and how things function in shelters. And with that, we were able to come up with a common goal, and we worked together very well. I think the other very important thing is that the criteria for reporting was set up right on the onset, before we even discussed the amount that we would be getting and how it would be dispersed. The criteria on reporting and also the accountability mechanisms were set up right on the onset, so we understood what it is that was required from us before we even started dispersing funds and spending the money.
Sikla, what do you think was the differentiator? Was it because the people at the Solidarity Fund, had the expertise, in other words, knew what they were doing? So when they listened or sat down with organizations like yours, they were able to listen, as Mariam says, precisely because they knew what needed to be done? Or did you find them being open to everything and anything, but just being able to listen carefully and say, okay, then maybe this is the direction that we should take? What was your experience?
Yeah, so our experience was we were looking at the fairness. It was a very fair application process, whether you are a small organization or a big organization, because we've been functioning for the past 7 years, getting assistance from the UK, and then that fund stopped, and then locally we were still striving and making relationship with the mayor's office. And then this year, because of the pandemic, we were hopeless, but they came through no matter how small we are, because we are functioning at the center where there is another organization. So we're just renting a space. Our services are open now. They were not looking at, this is a small organization. So with the documents and then the application, they were able to see that this organization is able to do ABC, the past experience, and then so everything was treated fairly. I think if we can have different funders who cannot pick sides or relationships, just look at on how organizations are functioning, because there are serious matters, things that we are dealing with on a daily basis, which many organizations are still crying for help even today. But they were able to just listen to us and then assist where we needed to get assistance.
Is that part of the problem, Mariam, what Sikla just said, that often, the people who are supposed to be assisting, NPOs and everyone else, don't quite or really understand how you guys work?
Absolutely. I think that's the biggest problem, is that even when you're dealing with national governmental structures, they're not the ones on the ground and they don't understand what's going on. We try to explain to them what is happening and how things should operate, but very rarely are they open to these discussions.
But you guys also don't sit back and say, oh, they don't understand us, Do you also make an effort to try and find some common ground with the people whose help you need?
Yes. Maybe I can name the few, because we've worked with AFSA in the past years. They were able to assist and listen. So now with Solidarity Fund, it's the same experience, because now they are able to listen on matters of this organization is doing this, which is affecting the whole city. When we look at the issue of kids that are living on the streets of Durban, it was started to be hectic, no assistance. These people are coming from different backgrounds with different problems. So if you are someone or a fund, an organization who can listen to a structure that is pushing that movement, you just assisting the whole problem of the country, because these people are the ones who can do a lot of things that can disturb the city or our communities. So, respect to Solidarity Fund for just not looking at what we are doing deeply on the streets, but assisting the organization as a whole.
I'm going to thank both of you for agreeing to come through this evening. Sihlendi Mao is a director with Ispepelo, an organization that focuses on young girls and vulnerable women who are at risk of homelessness in the eThekwini Metro. And Mariam Mangera, who is a project coordinator with the National Shelter Movement of South Africa. Both of them are beneficiaries of the Solidarity Fund that was set up over 18 months ago to assist people who were affected by the pandemic. The Solidarity Fund reporting today on the projects that they have undertaken, how they have spent the money, and as you heard from Adrian Enthoven earlier, the deputy chairperson, they have also learned some lessons, and I'm sure if these conversations continue beyond the pandemic about how best to perhaps do these things, the Solidarity Fund people have a lot to share with the nation, and I'm sure a lot of lessons to teach a lot of government agencies and departments in particular. After the break, we bring you some election news. Here's your elections update for this evening. Police say they are hot on the heels of those responsible for the brutal murder of Ward Councillor Tsepo Mutaung. Mutaung was local councillor at Ward 22 in Mabopane, north of Pretoria. He was gunned down on Friday.
I'm satisfied that we have the names of the people we want, we have the faces of people we want. It will be soon where everybody will be able to know why that happened. Our job as the police, while we pass condolences, that is not our main job. Our main job is to find out what happened and to bring those people to book.
Well, in the last 2 weeks, 3 women in KZN, Ngami Shange, Beatrice Nzama, and Pilisi Wejili were gunned down returning from a political gathering. Cope Egruleni Metro mayoral candidate Nzipho Kalipa was attacked, and last Friday, Tsepo Mutaung, we heard about earlier, was murdered. In political circles, there is now growing concern around the increasing number of cases where councillors and other political actors are being attacked or murdered.
We are very disturbed with regard to the number of violent incidents and killings that are taking place in this area of our province in Tshwane. These incidents of violence and killings have already resulted in loss of life of a number of councillors in this area. These incidents are also linked in great detail to the disruption of projects. These are infrastructure projects.
A disturbing trend indeed. Hopefully it's going to be nipped in the bud. Let's take you to the campaign trail. Now, the Democratic Alliance says it will pull the strides in making sure it governs the city of Johannesburg independently. Abongile Dumago compiled this report.
The race is on. Major political parties want a stake in the city of Johannesburg. The DA is one of them, as it launched its 7-pillar manifesto for the city today. Accompanied by DA leader John Steenhuisen, mayoral candidate Dr. Palazzi says, among other things, focus will be given to Soweto, where many residents suffer because they can't afford to pay for electricity.
We're also trying to rid ourselves of dependence on Eskom. Eskom in our borders has really failed our residents. There's areas, for instance, in Soweto where people have gone for 2 years without electricity, and we would like to take over such areas and use some of the technologies that we've already tested in other parts of the country where the DA governs to give our people affordable and reliable energy.
The DA is also weighed in on the decision by the United Kingdom to put South Africa on a red list following uncertainty on the number of COVID-19 infections.
But I think we do need to go back a step, because we need to know how we got to why we're still on that red list. And it's got a lot to do with the fact that we have a very low number of people who have been vaccinated. And the blame for that must lie squarely with the Ramaphosa administration, who woke up far too late in the vaccine race. We ended up having to get the scraps from the rest of the world while other nations were busy vaccinating at scale.
The DA says it is open to coalitions for the upcoming local government elections should a need arise. Abongile Tumako, SABC News, Johannesburg.
The Patriotic Alliance has welcomed members from the DA, the ANC and other political parties in the Western Cape in the run-up to the November 1 poll. The members include seasoned politicians. Patriotic Alliance has registered to contest over 1,300 municipal wards countrywide and over 270 wards in the Western Cape. The party says
a party that's for blacks, white, Indians. Of community service. That we cannot find the lead.
The party says it aims to build a diverse formation that will improve the socio-economic status of the marginalized people. The party also aims to build an inclusive economy that will ensure equal distribution of resources to vulnerable communities. And while political parties are on the campaign trail, residents of 5 villages just outside Thohoyandou in Limpopo are tired of waiting for government to provide services. After years of broken promises and bureaucratic red tape, they are now financing and building their own infrastructure. The community is currently paving a storm-damaged road that connects the 5 villages.
These citizens said they could have taken to the streets to protest lack of roads, but being law-abiding citizens, they decided to take development matters into their own hands. Displeased with what they call sluggishness from government, these people are getting down and dirty. Thousands of households have contributed resources in form of cash and labor. Some have issued forth vehicles and equipment, all in the name of bettering their lives. Residents say there are numerous attempts to get the road built by government were either ignored or rebuffed.
We're suffering. When we come from town, Joburg, wherever you drive your car, you don't drive until home, you pick your car somewhere, you walk here. But you got a car. Because this place, when it's raining, you can't even drive here. It's a bad place when it's raining here. We're suffering. People, they're suffering here. That's the problem. That's the main reason.
Even the people who maybe they are in bad condition to go to hospital, it's difficult. So if we are doing this by our own, maybe the government will do something for us.
We could not wait anymore. That is why we decided to contribute towards this project. Government has failed us. This is good for us and our children.
And with local government elections coming, their tone remains non-committal.
I don't think these people, these young ones, can go and vote because they are painful because of the road. I can go and vote because I'm an elder. Elders do agree to everything. But I am not encouraging them not to vote. They must go and vote so that they will be governed by the government that they have chosen.
Several kilometers to the south, residents of Tsianda village have just finished paving their streets. It took just 3 weeks to complete this Herculean effort. The project was led by women with financial assistance from their offspring plying their trades in other provinces.
rolingedza sa mukuvundu hoku ri chikadi shuma hankeni kha zwidine zwile zwe vha zwi vhona uri ri ise mulaedza kha dzi councilora.
As a village, we wrote to the municipality several times asking for help, and until today we have not received any response. We don't even know if they ever considered our requests.
Mukhanselara wa vurine u swika zwino a ri na vutanzi uri marafe e va ri isela one henenge ya masipala wa Shumakhado o swika kana hangu swika ngori a ri ya thu wana phindulo.
The Makhado Local Municipality and Road Agency Limpopo have not responded to questions on this matter, besides the SABC several attempts to solicit response from them. Rutano Bobori, SABC News, Vembe in Limpopo.
Failed by politicians, residents doing it for themselves. In Bekkersdal, on Gauteng's West Rand, residents say their 2014 protests over poor service delivery were all in vain. Services in the area still have not been provided. They still face overflowing sewage, uncollected garbage, high crime rates, and the lack of access to electricity, sports, and other recreation facilities. Bekkersdal is part of the Rand West City Local Municipality, established in 2016 following the merger of Western Area and Randfontein Local Municipalities. The 2014 protest caused over 11 million rands worth of damage to infrastructure. SABC News senior reporter Criselda Lewis and cameraman Mashudu Ramachela have that story.
So in the run-up to South Africa's general election in 2014, Bekkersdal here west of Johannesburg was a hotbed of violence. Polling stations and public buildings were torched over poor service delivery. So the subsequent local government poll 2 years later took place in peaceful conditions, but about 7 years after, ink had spilled onto these streets, and on the cusp of another election, we returned to Bekkersdal just to find a community still battling the very same issues. The stench here is overwhelming. Right next to it is a supermarket owned by Moses Maluleke, who is fed up. The task he has resigned himself to, work meant to be done by the local municipality, but he has given up on that. It benefits majority of the community, saving even children from the surrounding danger. Not just the filth, but manholes that have been opened for as long as he can remember. He has equally resigned himself to more municipal work, like making the road next to his shop more bearable. Moses says it's unbearable to live here. He says near his shop there is too much filth. He does not know where the municipality is. They also live in filth. He says it will be very difficult to vote in the upcoming elections because he says they vote and there's no improvement.
Service delivery right, but service delivery
A few meters away is the local taxi rank, where Tobeka Nomachila runs her food-selling business from a corrugated iron structure. And the only available toilet is shared between men and women. Tobeka says they need proper shelter here and that they fetch water from very far in order to cook. She says that they also share toilets with men. While this election will be about jobs and more jobs, Florence Matubatuba saw the gap and is helping young people empower themselves, like 23-year-old Tsulufelo Molibati.
When you train a person, you train the family.
When you train the family, you train the whole community. When you train the whole community, at least you bring the plate of food on the table. So some
sew at their homes and they make money. Others open their own businesses.
Something else.
So whichever political party or coalition of parties takes control of the West Rand local municipality after the November local government elections, it will be a mammoth task to revive the ailing and impoverished Bekkesdal. The township is in dire need of improvement, and its people are desperate for much needed services and a better life. Crisalda Lewis, SABC News in Bekkesdal.
And that's the Watchdog for this evening. To join us again tomorrow evening at 8 o'clock. Up next, The Globe.